Yeah. So I just want to see the blue marks in the front.
Hello, Natalie.
Hi, nice to meet you. I'm Dr. Hyungjin Lee. I'm here at TMJ Head and Neck Pain Center. So I'm seeing patients for their jaw pain and sleep apnea, and I give them oral appliances. Okay, so I'll explain to you about sleep apnea and how the oral appliance works, okay?
Yes.
So we're looking at a person from the side here. So that's the ear, the nose, the tongue.
Mm-hmm.
When we breathe in and out, it goes through our nose, and then it follows this passage down into our lungs. It comes out the same way. So if we see here, this area is already kind of narrow. So
Yes.
And that's the area where it gets blocked when we have sleep apnea episodes. So it gets blocked by the back of our tongue and our uvula and our soft tissue. So if we move to this photo, now you can see the airway is blocked by those structures. So when this is going on, or this usually happens when we go into deep sleep, but especially REM sleep, and that's when our muscles relax. Our neck muscles, our tongue muscles, and our jaw muscles, when they relax, our lower jaw falls back. And when our lower jaw falls back, the tongue and the tissues that are connected with our jaw, they fall back together, and that's what creates the blockage here. So we are not able to get air into our system, meaning our blood now will carry less oxygen in them. So that puts a stress in our heart, because now our heart has to pump the blood harder and faster so that the organs like our brain and so that they can get the same amount of oxygen that they need.
Does it affect the blood pressure?
And yes, so when our heart is beating fast and harder, it elevates the blood pressure. So it puts stress in our blood vessels also.
So sleep apnea is related with the high blood pressure as well?
Yes, yeah, and heart conditions too. So when our brain senses all these things going on, it kicks you up from that deep and REM sleep into light sleep. So that's why you toss and turn, or you feel the urge to go to the bathroom, or at times it wakes you up fully, gasping for air, or hearing yourself snoring. So when that goes throughout the night, you go back down into deep sleep, you're kicked back up, and when you go back and forth like that, you end up not getting enough good rest. Okay? So for CPAP, what it does is you wear a mask on the nose or nose and mouth, and it pushes pressured air into that area to open the airway. So that pressured air opens it. So if you have a good seal, you're going to get a good airway in. So it's a very direct and effective device, but the compliance rate on it is not very good. So the oral appliance, what it does is you wear it on your top and bottom teeth, and it keeps your jaw a little bit more forward, and it keeps it from falling back. So when your jaw doesn't fall back, even after your muscles are relaxed, it can stay forward, and the tongue and the tissues have better chance staying more forward, so that you can keep the airway open. Okay?
Nice.
Yeah. So this is a herpes device. It's one of the most common ones that patients use for sleep apnea. So it looks like this. You wear it on your lower teeth and your upper teeth like this. And it keeps your jaw forward, as you can see, and it keeps your jaw from falling back. So you can go forward, you can go side to side with this particular device, but it doesn't let your jaw fall back. Okay. But there are some side effects of using an oral appliance. Because your jaw stays forward throughout the night, your jaw joints might like to stay there. So that can change your bite a little bit. Okay. There are exercises to get it back. There are devices that you can wear in the morning that gets your bite back. But your teeth and bones can change as well when you use the device, because we are relying on them to keep our jaw forward. Okay. Another side effect is that obviously you're using your teeth to hold the jaw and the tongue forward, so you're putting pressure on your teeth. So you have to have good teeth. So it's good. It would be good to go to your dentist and make sure they know about it and they do a thorough checkup whenever you go in every 6 months or 4 months. Okay. And lastly, some patients might have some jaw joint and muscle aches when they use the device because it puts your joints and your jaw in a different position. So it's possible that you might feel some soreness or even pain as you get used to it. Or, you could have a bad night where you clench and grind a lot and that could flare up your symptoms. Okay. So those are the 3 main side effects that you could have with oral appliance.
I see.
Yeah. Have any dentition, normally they cannot wear an oral appliance. There is a tongue retaining device where it has a little suction on your tongue so that when you wear that, your tongue stays forward.
Oh.
For some patients, that could be effective. But there are patients with, denture, overdentures that can support the oral appliance. Obviously, it's not going to be, you're taking a risk with that also, right? But there are patients that have dentures that fit really well that still tries the oral appliance. I've seen some patients that works out, but most patients they're not able to use the oral appliance with full dentures without implants.
So if a patient has an implant and if they have the implant to support the denture, they can wear this appliance.
They can, but with knowing the risk, because you're putting more force to the implants.
Oh, I see.
Yeah.
Okay, thank you so much for the explanation.
Yes. Laboratory. Yeah, we make splints here. We do some repairs for oral appliances.
Do you also make dentures?
Right now I'm not making any dentures, but I collaborate with other dentists.
Oh, how do you collaborate?
So we do the splint treatment, making, so a lot of patients have their old dentures that they've been using for 10, 15 years.
Yeah.
But when they use it for that long, their bones disintegrate and their vertical dimension becomes too low.
Yes.
And that can cause problems with their muscles when they chew, and also it can put pressure on their jaw joints. So what I do is I temporarily raise up their vertical of their old dentures and make sure their symptoms alleviate with that. And then after that, I collaborate with their general dentist in making the new dentures.
Oh.
So yeah, so what the patient does is they will bring the wax block to our office, and then I check and make sure their vertical is good. And then I'll send it back with the patient to the dentist, and then they process and finalize the denture, deliver it, make sure it fits well, and then they come back to get it checked again. But after that, their symptoms are much better.
You're just shadowing today?
Yeah, I'm shadowing. Are you lining a little bit?
Yeah, I'm just gonna get like the rest of the teeth
Mm-hmm.
because I have like 2 contact points. I'll just start mixing. I just, if it's like too thick, it doesn't come out like
Nicely?
Yeah, it doesn't come out like clear. It doesn't always come out clear, but if it's too thick, then it'll come out looking more white and opaque. So I just kind of mix it running like this and let it set up a little bit. just like pour it in here.
From the back to
Yeah.
fill the. Oh, that's good.
Set up a little bit. So I'll put it in the warm water. And then later on, I'll just add more on the inside to kind of make it smooth. That way there's like no holes and rough, because if there's holes, then it irritates the tongue.
So I got the point. You first establish the posterior teeth, and then you're going to make the anterior area, right? Basing on the posterior bite.
Yeah, so first, we get the contact points and we check the height, and then lower it as needed, and then balance it really quick, like initial balance, and then I'll add the acrylic to capture the rest of the bite. Because sometimes patients don't know where to bite, and they bring their jaw forward instead of biting naturally on the back teeth. They'll want to come forward.
Oh, cool. How many minutes do you wait usually for the acrylic to set?
Maybe like 5 minutes. And sometimes like there's like bubbles, I'll just like kind of push it in. And then like if there are any like bubbles, then I'll just fill it in later. Bubbles here, and bubbles here, so I'll just fill it in later, and then I still have to like fill in this area. So it's still like soft and setting. So if the water's like not warm enough, add a little bit more warm water, but not too hot. You know, it starts to get hot when it sets. So then that's how I know it's setting. Oh, and then what I do to make it easier, I just mark the areas where it needs to have the contact. So when I trim the excess.
Oh, you don't reduce those areas.
Yeah. And I also do here, that way I know where to stop trimming.
So should anterior touch, or anterior teeth needs to touch, right?
Yeah, so not naturally, but when they grind forward, you want it to touch. Yeah, and then
okay.
side to side too.
Oh, okay. Building it on the F6 retainer? Are you building it on top of the F6 retainer?
Yeah. Yeah.
The plastic one. Can I touch?
Yeah.
Okay. So it is what you made with this one, right? Vacuum.
Yeah.
Oh,
yeah,
okay.
and then you add.
Acrylic.
Yeah.
Oh, okay.
And then I have to add inside because it's like rough.
Yeah.
But I'll do that like towards finishing.
So what I'm doing is I'm getting rid of the blue marks. That's the excursive movement. I know a lot of dentists do it differently, but the blue marks, I want them to show it in the front, but at the back, I just want to see a dot of red. So, yeah.
Because as you said, you want to remove the all the posterior teeth set free from the excursive movement.
Right, yeah. So I just want to see the blue marks in the front, and then at the back, if it's showing anywhere, I just want to remove it. Yeah. Slide your lower jaw forward. Okay.
Oh, way
Good.
part?
Yeah. Slide back. Slide to the right. Slide to the left. Okay. Good. And then when you let go,
Too quick.
when you let go, you're just letting go. So let go. That's
Okay,
right.
you know-
Yeah. Breathe in. You can do it slower even. Yeah. If you do a couple times, you can already feel you're more
I
relaxed.
do while I'm walking. You know, when I want to.
You can do while you're walking. Yeah. Good.